This is the WHTC Morning News with Gary Stevens and Peg McNichol on 99.7, 1450 WHTC and WHTC.com.
Welcome back to the WHTC Morning News for this Friday, July 2nd. We may be on the other side of the COVID-19 tunnel, but right now things are not totally out of the clear yet. To get us updated on the situation involving the outbreak and some other health news, we are very pleased to be joined today by the lady who has been the lead spokesperson for the Ottawa County Department of Public Health for almost 10 years. It's not been that long. Kristina Wieghmink on the other side of our Zoom connection. Kristina, good morning.
Good morning. How are you?
It is not, we're doing okay. We are doing okay. Certainly, as we talk on this Independence Day weekend, things are looking good, even though the outbreak continues to be a factor with the Delta variant now in Ottawa County, as it is in all 50 states. We just cannot let our guard down in this regard.
Yeah, absolutely. We are at a good place as far as our data. We're seeing our average daily cases are about 5, and our positivity rate is about 2%. So that's really good news. But you're right, we still need to be vigilant and making sure that we're still practicing all those disease prevention measures, still physical distancing and washing your hands. Masks aren't mandated right now, but if you're at higher risk or unvaccinated, we still highly recommend that you wear them because yes, the Delta variant is now in Ottawa County and it is much more contagious.
Now, are you getting a sense that people are over the frustration aspect of this? Because we've had this in basically since March of 2020. We've had restrictions and concerns, and we've had, I would say, the entire spectrum of emotions since that time. Do you get a sense now that people are over the frustration aspect and are saying, okay, if this is there, we'll just deal with it?
Yeah, there's been a huge range of emotions, as you mentioned, throughout this pandemic. A lot of hardship on people, a lot of loss. So many people are still picking up the pieces. But I do feel that a lot of people have some sense of relief with all the restrictions lifted. It's looking like things are back to normal, even though we still need to be careful. Some outbreaks might happen in different pockets of the population. But overall, I think people have a good sense that we have gotten through this or we're nearing the end. And, we couldn't have done that without such a strong community and so many strong partnerships that we have here in Ottawa County.
Kristina, there is the annual report issued by the Ottawa County Department of Public Health, but it's in video form. Tell us a little bit about that.
Yeah, so the annual report is a big project I look forward to every year. It's an opportunity for us to share stories of what we do in public health, highlight different people in our community or different staff members. Excuse me. And before the last several years, we've had like a magazine format in print. But this year, since so many things were done virtual and in video, we decided to do a video annual report. And you can find that at miottawa.org on our COVID page. Or else at our YouTube channel at youtube.com/MIOttawa. So what we took there is 15 months worth of hard work from so many different people and compressed it down to 10 minutes. So as you can imagine, that was very, very difficult, but hopefully we hit some of the highlights of when the virus first came to Ottawa County and then the hope of vaccination.
Kristina, obviously the outbreak has been first and foremost in the minds of many people, and obviously with the Ottawa County Department of Public Health. Is there something we've been overlooking over the past year in terms of health in this county that maybe needs to be spotlighted away from the COVID-19 situation?
Yeah, absolutely. Our communicable disease team is still hard at work dealing with other diseases other than COVID-19. We have, vaccine preventable diseases that children need to get their vaccines so we can avoid other outbreaks like chickenpox. And then, of course, measles, we don't want that coming back to the area. But then also we have foodborne illness outbreaks of norovirus, and then issues with ticks and mosquitoes. So all those public health concerns are still there. It's good to see that now, with COVID not being such a wildfire right now, our staff can also focus on a lot of these other mitigation strategies for these other diseases.
What about dealing with regular health issues? Obviously, not everything can be done by the Department of Public Health in Ottawa County, but certainly dealing with pregnancies, dealing with good child care in terms of getting the kids healthy, especially getting kids healthy for school. That still needs to be a factor in terms of keeping things in front of mind for the department and for the public in general.
Yeah, absolutely. Right now, we're having open appointments for hearing and vision screenings. Kindergartners need those before school starts. So if you still need to get your child in, please give us a call. We do have home visit programs where we work with mothers and pregnant mothers and infants. So that's ongoing. Our food safety inspection reports at restaurants are ongoing, and well and septic inspections. So there are many other services in public health besides vaccination. Yes, so we are continually doing that throughout our community, and those services are up and running fully. So hopefully, if you need anything from us, be sure to check us out on the website or give us a call.
Kristina Wieghmink has been a familiar voice on these airways for a number of years, first with the Holland Museum, then with the Ottawa County Department of Public Health. But after we chat on July 2nd, well, not exactly the first moment or so after we chat, but July 2nd, she is stepping away to a new challenge. Tell us all about that, Kristina.
Yes. So it is with deep regret that I will be leaving the Ottawa County Department of Public Health. Today is my last day. I did accept an official offer from the Food and Drug Administration. I'll be working in their Center for Devices and Radiological Health and their external communications branch. So it's a new adventure. My office will be just right outside of Washington, D.C. I will stay in West Michigan at this time to work remotely from home. But it's going to be exciting, a lot of new things to learn, and a lot of other challenges that I'm sure I will face too.
Talk a little bit about, when you first came with us, you were talking about things going on at the Holland Museum and delightful things were going on there. Then the challenges of being the person that coordinated the information with the health department, and there was many challenges before March of 2020. Are you seeing your career going in a way that you thought it was going, or are you seeing your career going, Kristina Wieghmink, as almost as if, I didn't imagine me doing what I'm going to be doing in Washington, say 10 years or so ago?
Yeah, absolutely. It's always exciting on what life brings you day to day, let alone 10 years from now, and who knows what it will look like in another 10 years. But going through college and, doing my different studies of anthropology and also multimedia communications, a little bit of a different background there, but it brought me all to the various professions I've been in so far through, working at the Grand Valley State University, to the museum, now to the health department. Years ago, I would not have ever thought that I would be at the health department, but I've been so fortunate to meet so many wonderful people, in our department, in our community, learned so many things about what the work that they do. And I'm really excited for this next adventure. On a federal level, there's a little bit more to learn, but I'm excited to be with the federal government, and we'll see what happens over the next 10 years.
Kristina Wieghmink, I think I speak for all of us, not only here at WHTC, but our listeners. Over the years, we've appreciated your cooperation and your insights in your roles with the Holland Museum and with the Ottawa County Department of Public Health. We wish you well in this new challenge. We look forward to maybe chatting with you again sometime soon. Take care. Thank you, Kristina Wieghmink.
Thank you.
Thank you, Kristina Wieghmink, on 99.7 and 1450 WHTC.